Welcome. I'm Kelly Dewar, Senior Shelter Solutions Specialist at Maddie's Fund. Maddie's insights are practical tips based on current research to help pets and people that you can use in your shelter. Today, we're joined by Dr. Claire Corridan of Great Expectations Veterinary Consultancy. Dr. Corridan is a veterinary surgeon with a doctorate in animal behavior and welfare. She's had a varied career combining first opinion and veterinary behavior referral practice with research and teaching in animal behavior, welfare, and ethics, focusing on the human-dog bond, behavioral prophylaxis, promoting animal welfare for both companion and farm animal species. Her talk will explore aspects of trauma-informed care for humans which might be applied to dogs, focusing on the assessment of shelter dogs or those presented for problematic behaviors and the potential for protecting puppies from adverse early experiences. So let's welcome Dr. Corridan to learn more. Welcome.
Hello there. Yeah, I'm joining you this evening for me from County Limerick in Ireland, where I've been living for the last 5 years. And I guess my world changed quite dramatically just about 4.5 years ago now, when I became a foster parent. And in learning about children in care and the challenges that face them on a daily basis, I started thinking how much of what I was learning seemed applicable to my veterinary patients as well, particularly those that are coming through rescue, that are perhaps presenting with behavioural challenges as well, and particularly where we don't know where they've come from and what the actual history is. It's that there's so many things that I was joining up in my head and thinking, this to me is revolutionary, and why have we not been talking about this up till now? So this evening I'm going to give you a glimpse of the research that we've actually been doing at UCD in Dublin, and hopefully give you food for thought as to how perhaps this is something you could be thinking about with the animals in your care. As anyone who has worked in human social sciences, particularly social work, or have had contact with children in care, will be familiar with this term. So I'm going to talk about why the light bulb moment went off in my head when I learned about trauma-informed care, and why I think it's something that might be useful for us initially in dogs, but also potentially in other species as well. One of the key aspects of trauma-informed care in people is looking at adverse early experience. And that terminology is something that we could quite easily be thinking about. We mentioned the fact that we're going to talk about puppy farms in particular, and early experience in puppies and how that sets them up for life. But there's a number of things or situations in human social science and where people are living closely with dogs in particular. Dogs are going to be exposed to the same challenges that are going on in the household where there's people that are experiencing adverse experiences too. So we'll look at which areas definitely apply to both, and then which areas perhaps are less applicable when we're talking about animals versus people. In shelter medicine, we have a number of different conflicts. We have infectious disease control. We have the needs of a particular charity or population of animals. And then we're always trying to balance that against the individual and what they need. So we're going to look at where the challenges are and where there are potential compromises that might actually be beneficial, both for the individual and for the organisations that are trying to care for them as well. And hopefully we'll have some time at the end for us to discuss some of the practical application of this. Our paper only came out last year, so this is very, very new in terms of canine welfare. And in terms of actually applying it in the field and in shelters and in veterinary behaviour clinic environments, this is something that's very, very new. So we're very much talking about the potential for this, as opposed to having data for me to say, we've done this and this, and this is why it's working. This is why we think it's so beneficial. This is very much a work in progress. So the background trauma is something that I'm sure we're all familiar with. Some of us may have experienced trauma ourselves at one point in the future. We almost certainly know somebody close to us who has been through it. And the concept of PTSD, I think, is very much established in human medicine and psychiatry. It's something that within the veterinary behaviour field, we're very much still talking about PTSD type conditions and PTSD type symptoms or signs in our veterinary patients. If trauma and PTSD are something that's quite novel in terms of veterinary behavioural medicine, the term trauma-informed care, where we're actually targeting the sort of treatment or management for animals who've experienced trauma is definitely going to be something novel. But there are a number of things that we can learn from human medicine. If we accept that dogs in particular can experience trauma and therefore have the after effects of that, which may be emotional, they may actually manifest as physical symptoms for some of these dogs. If we're going to view the management of the dogs through a trauma-informed care approach, we're going to have to think about the type of trauma that we think has happened, and also how best to safely manage the animals without re-traumatizing them, and being mindful of the needs of the individual and not pushing them too far or too quickly, and utilizing what we know from human medicine and picking the bits that we think are applicable and safe when we're working with animals as well. Now, adverse childhood experiences, obviously that specific terminology is not going to be applicable to our species. We could simply talk about adverse early experience, adverse puppy experience, apply it to whichever species it is that we're referring to. And then the window of tolerance is a concept which sort of evolved through the research into trauma-informed care. And I think that in particular, that is a tool that I've been using probably for the last 2 or 3 years now with problem behaviour cases. And I find it's a really useful tool, particularly for helping clients or pet caregivers to understand why their pets are reacting the way that they are, and how best to not only empathize with them, but also help them to self-regulate and calm a situation that could potentially be out of control or obviously problematic for both the animal and the people around them. So trauma itself, what are we talking about here? And I'm going to use one of the sort of the main researchers when it comes to trauma-informed care in people, Bessel van der Kolk. He did the early work with war veterans in terms of PTSD. So he was one of the sort of pioneers of this concept. And his definition of trauma results from an event or series of events or set of circumstances experienced by an individual as physically or emotionally harmful or life-threatening, and that it has lasting adverse effects on the individual's functioning, mental, physical, social, or emotional well-being, or any combination thereof. And I think that's really, really key, in that we can't isolate an individual in terms of their welfare. All of these different aspects of welfare are interwoven, and it's very difficult to separate them out. In terms of what we know about post-traumatic stress disorder in people, as far as I'm aware, there is actually research looking at this, and in similar situations and scenarios with working dogs, military dogs in particular, who've been in war zones, who've perhaps been around explosions. They have been called into work where there's been natural disasters, and both stressful people and stressful, dangerous situations that they've been exposed to. Their handlers, in some cases, have experienced trauma and the after effects of that. And we know that in a number of cases, the dogs are suffering similarly. So this is something that is now being looked at in canine welfare as well. In terms of people and what we know for them, the sufferers of traumatic neurosis, now known as PTSD, develop a chronic vigilance for and sensitivity to threat. So I'm sure all of you have met dogs who are scanning the horizon at all times. And if they hear something, see something, it could be a light flash, it could be a sound, they appear to overreact to that. So that chronic vigilance or hypervigilance is something that I'm sure you're all seeing in the animals that you're working with, irrespective of what their backgrounds are or what sort of trauma we are assuming, or perhaps we know for definite, what they've been through and why they're reacting the way that they are. The nucleus of the neurosis is a physioneurosis. It is not all in the head. It is a physiological process. So where we have this debate about, is this medical or is it behavioural? And I've seen conference titles which are sort of investigating this idea, and veterinary practitioners in particular who are sort of saying, right, well, we can't find anything clinically wrong. It must be behavioural. We cannot separate this out. Where there has been trauma and where an individual has had an adverse reaction, we cannot separate out what's going on in terms of their brain, what's going on with their social relationships, and then what's going on in their bodies as well. If they perceive a threat as real, they're going to be feeling it. Their body, their physiology is going to be reacting, irrespective of whether the threat is real or not. It's triggering them, and it's bringing back the physical sensations that they experienced through the original trauma. Now, people who've been abused as children often feel sensations such as abdominal pain that have no obvious physical cause. And I think this is the thing that vets in particular find really problematic. If we cannot see an abnormality on a list of blood results, or something that we can point out on an x-ray to say that's the problem, that's where it's coming from, it's very difficult for us, first of all, to put a label on it, but then second of all, to take it seriously. And the other important factor from the human research is that there are actual anatomical changes in brain development. And obviously there's particular vulnerability in a developing brain. So where we've got a puppy or a kitten and we've got, a juvenile neonatal brain, they're going to be much, much more vulnerable to the physiological effects of stress and trauma that they may be experiencing either in utero or in the early days and weeks of their development. Can we advance? Thank you. So the main sort of concepts with trauma-informed care are making sure that the individual feels safe. So the way that we're going to speak to them, the environment that we're bringing them into needs to be as controlled and safe as we can make possible for them. Everybody who is interacting with them needs to be doing so in a trauma-informed way. Now, one of the challenges we sometimes have here is where we have individuals, maybe within a shelter or within a veterinary practice, who are really interested in this and have done a lot of additional training, and they're very much thinking along these lines in terms of low stress handling and thinking about the needs of the individual. We need everybody who is interacting with a traumatized patient to be mindful of this and making sure that the individual feels safe and that nothing is going to happen around them that's potentially triggering in any way, and that we are not unnecessarily exposing them to any sort of situation that could result in them reliving the original trauma. And I know for me, I've been a vet for 26 years now, and I know in the early days when we were seeing behaviour cases, we routinely walked problem dogs past other dogs to see what their reaction was going to be. And knowing what I know now, obviously I understand how dangerous and actually damaging and negative that can actually be. So things move on, we learn more, and things that we did all those years ago ago are now no longer really acceptable. We need to be really mindful of that when we are in any way testing an individual in a shelter, when we're thinking about who the potential the forever homes are going to be and what they're going to look like, and who they're potentially going to be safe around, whether it's kids or other species of animals as well. Now, so we need to minimize re-traumatization, but we also need to think about labeling. Now, labeling is something that, again, we've been doing for a very long time. So an individual patient in a veterinary practice or in a shelter, in the front of the kennel door, we're used to labeling animals in terms of how easy or difficult people perceive them in terms of handling. So there's pros and cons to that. We need everyone to be safe and to be mindful of potential risks. But just think about if we start using terms like watch or aggression or bite risk, or it's just what implication does that have in terms of a new individual perhaps approaching that kennel, in terms of how they're then going to interact with that animal? And how does that change not only the perception of those that are handling them or potentially fostering or adopting them, but also the actual care for that individual? Are they going to get the same level of attention and care that another animal who was not labelled in such a way would be receiving? So there's pros and cons. We have to think about risk analysis and keeping everyone safe, but just also be mindful of this idea of judging, and that because an animal's behaved in an aggressive way in the past, it's really important we know what that situation, what was happening in that situation. Was the animal triggered in some way? What are those triggers? We need to, that's much more useful information for us than putting watch or high risk or red labeling or whatever system you use for grouping the animals in your care. And finally, in terms of the approach of the management of cases, it's really important that we realise the impact that trauma can have for an individual. Now, depending on the level of trauma, sometimes it's a repeated trauma, sometimes it's one really awful incident that has caused psychological damage to the individual. And we need to realise that those individuals are going to be dealing with that for the rest of their lives. And if we're mindful of that, and instead of labelling them or being, in some cases, fearful around them or judgmental, we recognise that this is an individual who's been traumatised and they deserve empathy and care that recognises that. We need to respond when they're frightened and ensure that we return them to a safe space as quickly as possible. And if that means that whatever our plan was needs to be, rejigged a little bit and we try again another day, then so be it. We need to be learning and recording as much information about that individual as we possibly can. So the things that make them happy, and then the things that are frightening or upsetting or that bring out the worst in their behaviour. And then I've mentioned about the risks of re-traumatizing. So there's been a huge number of studies looking at temperament testing and shelter environments and the pros and cons of that. It's worth thinking about how long an animal is in the care of the charity, the shelter, before any sort of testing is carried out, and then also be mindful of what is actually involved in that testing. Are we setting that animal up for success, or are we potentially re-traumatizing them? And this is something that we've been doing in shelters for a very long time now, and this is it could be in some cases quite revolutionary in terms of how we approach things, how much time we give animals to stabilise and acclimatise to a new environment and new caregivers before we try and look at any sort of assessment process. Can we go to the next slide? Thank you. And I think this is fundamental. I've now fostered 4 children, and I know that and they've all come from different backgrounds and they've got different challenges as a result of that. But it's really interesting when you think about, when you take a child or a dog out into the big wide world out there, and if something happens, if a child starts to get upset, or perhaps they're not getting whatever it is that they want, and you see a parent starting to struggle with that behavior, in times gone by, there would be a risk of a huge amount of judgment going into that situation. Whereas I think the more we've learned in terms of child psychology and the challenges that some kids now face, I'm hoping that now when we see that tantrum in the supermarket or in the toy store or wherever it may be, we're now actually feeling empathy, not only for the child themselves who's upset, but also for the person that's trying to manage that and keep them safe, allow them to calm down and get them safely out of that situation. Now, I'm not sure we still see the degree of empathy that I would like in terms of our aggressive dogs. So one of the biggest challenges I have when I'm talking to people with a problem behavior dog, because we're still seeing more cases presenting with aggression than anything else, irrespective of the fact that most of those cases are motivated by fear. People tend to judge. Even when a dog is absolutely calm and quiet, but they're wearing a muzzle, people make a judgment when they see a dog wearing a muzzle, instead of thinking, right, well, that's a responsible owner and a dog who's now muzzled and that cannot hurt, or certainly can't bite anybody. They could still give someone a fright or jump up. But the biggest challenge that my veterinary behaviour clients experience is dealing with other dog owners and members of the public out there when they try to go to the park, or they try to go to the beach, or they try to just walk down the street outside their homes, and they find that challenging because people are judging the fact that their dog is jumping up and down, their dog is barking, their dog is potentially looking aggressive, instead of thinking, well, why are they doing that? What has happened to them to make them react in that over the top way? So instead of saying, why are you doing this, and why are you being so difficult, and why are you embarrassing me like this, it's saying, well, actually, what's happened to this child or this animal that's making them so upset, that's making them triggered by the tiniest thing that doesn't make any rational sense to anybody else, but to them it makes complete sense. There's something there that's taking them back to that traumatic experience, and they feel out of control, and they need to be treated with empathy, kindness, patience, and understanding. Next slide, thank you. So I believe that this paper is the reason I'm here this evening. This was a project that I was able to pursue while I was at UCD, but it was working with a very good friend of mine, Sue Dawson, who spent a career as a child psychologist dealing with children with the most horrendous experiences of life that I don't know how she slept at night hearing the stories that she did, but somebody with vast experience of trauma in children who happened to be married to a vet, so understood the challenges that we experience with our canine and feline patients as well. And I rang her up after a TIC course that I'd attended and said, so am I completely off my head? I think this totally applies to dogs and cats as well. If they've had any sort of trauma, if they've come from a puppy farm environment, and we know that their early experience was not as we would hope it would be, surely this applies to them. Surely we could be learning something useful from what they're doing in human medicine now. And thankfully, she said, do you know what? You're right, and we need to be looking at this. So this paper is the result of that. So finally, I wanted to have a look at a comparison of treatment approaches utilised in children and in dogs. And as you can imagine, not all of them are suitable for applying to our canine patients, but there are definitely some insights that they use with children that would be helpful in terms of us thinking about a TIC approach in dogs as well. So when you start doing translational studies, it's really interesting. There are a number of studies specifically looking at TIC in rats and chimpanzees. But there's also a huge amount that we can learn, particularly in terms of in utero trauma in people, because it's been so well documented. It's really important that we understand we've been talking about early experience and how important it is to get things right early on, and making sure that breeding animals are kept in the right environment and protected from stress as much as possible. But this really is truly vital in terms of the later behaviour and temperament of the young. Prenatal or maternal stress and depression will impact on the developing fetus. And dog owners can report unpredictable or excessive and exaggerated responses to stimuli in their patients. Fear and anxiety are unpleasant emotional reactions to the presence of or potential presence, and I think that's really key here. So even if the situation or the trigger that we know is a problem for the individual, even if they are completely absent, there could be an associated trigger there that makes absolutely no sense to anybody. They've never seen a reaction to this before, but all of a sudden the animal is reacting as if just as badly or nearly as badly as if they were exposed to the situation that we know is a problem for them. So they extrapolate, and what starts out as one situation ends up being multiple triggers. There's no empirical data to distinguish between the different types of anxiety and fear in dogs at the moment. This is very much something that is developing, and you'll see a number of different uses or combinations of terminology. But in terms of investigating the impact of trauma on dogs, this is something that's still fairly novel. Now, adverse experiences themselves should not be the focus. It's much more important that we think about the long-term impact on the patient. And I think that's really key in shelters, particularly when an animal's been picked up perhaps by a dog warden, or they have been found abandoned, and they are just an unknown quantity. We don't know what they've been exposed to in the past. It's really important that we record as much information as possible about that individual when they do encounter a new situation or something that they react either hugely positively towards or negatively in terms of a fear response or even an aggressive response as well. So the trauma itself, if we know what it is, then it might help us in terms of trying to protect them from future exposure, but that is not the be all and end all. It's what is the impact on that individual. So some people or some animals could be exposed to something that is hugely traumatic, and for whatever combination of experience, genetics, they are able to they seem able to cope with that very well compared to another individual whose life is, dramatically changed as a result of experiencing the same trauma. And then, at the other end of the scale, something that's perceived as fairly minor to one individual could be life-changing for a different individual, again, because of their combination of genetics, experience, and life resilience. So trauma can happen at any age, but in that juvenile animal, where they're in utero or in those early days and weeks of development, their brains are developing at such a rate of knots, they're so much more vulnerable to the toxic effects of stress hormones. In human social work, they talk about the infants who have been marinated in terror, where there's been domestic violence, where there's been narcotic misuse or alcohol misuse, and that early stress and that early exposure to toxins, external toxins, but also the neuroendocrine response of the mother or the dam in our case, that's going to have a lifelong impact on that individual, and that cannot be underestimated. So there has been some documented studies looking at this in chimpanzees and rats, and now we're starting to think about it in dogs. But I spent the last couple of years working in animal welfare and ethics at UCD, and we were doing a welfare project looking at dairy cows, and one of the big things we talk about is separation of calves from dams and what impact that has on their growth, their risk of disease, and there's absolutely no reason why we couldn't be talking about the impact of trauma on calves, lambs. Basically, there's any animal species, particularly as a juvenile animal, they're going to be so much more vulnerable to the impact of stress and trauma. So the kind of our adverse early experiences that we see in human social work, and there's many of these that dogs living in the same household as some of these situations are going to potentially have some of the impact as well. And obviously some of these are going to be quite unique to dogs as well. So like things like physical neglect or psychological neglect. We see a lot of problem behavior cases where dogs have been left in crates for substantial periods of the day. So perhaps they're safe, but they're not getting what they need in terms of mental or social stimulation. Where there are challenges within the actual household, so if there's physical health challenges in terms of illness, there could be mental health challenges, substance abuse, domestic violence, all of these things. If it's happening in the household, the animals living in that household are going to be experiencing that at the same time. And in terms of what impact that has on them, obviously that's going to be situation specific, but it's just something that we should be mindful of. Now, verbal abuse is an interesting one. In terms of animal abuse, there's lots of documented evidence in terms of the various types of physical abuse that animals experience. There's not a huge amount in there about verbal abuse, but I'm sure you and I both know that this is something that dogs in particular are potentially going to be exposed to, and we know what damage that's going to do to the human-animal bond and the challenges we're then going to experience in terms of rehabilitating and then hopefully getting these dogs into forever homes as well. Now, as far as I'm concerned, any dog who has been picked up as a stray, has been taken into the care of a charity or a veterinary clinic without their owner, if they've been relinquished or abandoned, they have experienced trauma. So whether their owner has died and they've had to be given up and they've had to be rehomed, or whether they've experienced the various degrees of trauma, for that individual animal, that is perceived or considered as a traumatic experience. And obviously our job in terms of caring for them and trying to get them into the right future environment, we just need to be mindful of what they've potentially gone through in the past and what impact that's going to have on them in the future in terms of how we're going to assess them and how we're going to find them the right place to move to next. The physical harm, as I say, that's very well documented and something, sometimes we'll see the effects of that when they come into shelters in terms of them being emaciated. They might have physical lesions we can see. Now, the threatened or actual violence by peers is an interesting one because interdog aggression obviously is a huge problem in terms of veterinary behavioural medicine. And this idea that, a dog might have been, there might have been an incident in a park or on the pavement with one individual dog. There might have been physical harm. It might just have been threatened harm, but the future impact on that dog, depending on their genetics, breed, experience, resilience, could actually be lifelong for them. So this idea of either threatened or actual violence by peers is something that absolutely our canine patients are exposed to on a regular basis. Behavioural signs associated with early trauma. So we've got lists here and references for those of you that are interested. But if you look at these behavioural signs, these will all be things that you recognise in the dogs or the cases that you're looking after. So aggression obviously is a big one. ADHD-like behaviours, absolutely. Avoidance, so a response to triggers, an over-the-top response to what's perceived as an innocuous trigger to everyone else, but for that individual animal is taking them back to a place that they really don't want to go. Depression and low morale is absolutely documented in dogs. Memories inducing flashbacks, disturbed sleep. Isn't that interesting in terms of, I'm not aware of any studies that look at sleep patterns in dogs as they arrive in shelters and how that changes as as they stabilize and become acclimatized to that new environment and their new caregivers. That's a really interesting one. And assuming everyone believes they dream, there's absolutely no reason why they couldn't be experiencing similar flashbacks or scary nightmares as a result of previous trauma. Reactivity is the big buzzword here. I don't know if it's the same for you guys in the States, but I'm seeing dogs labeled as reactive left, right, and center. I don't know if the perception is that it's less scary or less judgmental than calling them aggressive. Reactivity in itself doesn't tell me an awful lot. I'm much more interested in why they're doing what they're doing. What are the triggers for that individual, and is this something we can minimize or manage or find an alternative more positive association for that animal? Rule breaking and disobedience is interesting, and obviously much easier for us to conceptualize in people. And I've already mentioned about the sleep disturbance, but the idea of flashbacks and memories is something that's really interesting. And the more MRIs we do in problem behavior cases or trauma cases, the more we're potentially going to learn about what's actually where the brain activity is and what's actually going on in these individuals. So these are the behavioral signs that are documented in human medicine, and we need to be thinking about and researching each of these in terms of how they apply or could apply in dogs as well. But it's something to be mindful of, and to where you see evidence of this in a shelter animal, it's really important that we're recording it and looking at which situations in particular are triggering these types of behaviours. This one's really interesting when we talk about that that differentiation between behavioural medicine and clinical medicine in veterinary cases. So we know with people where there has been trauma, we have got a list of physical manifestations of that stress. And this is not something that has been hugely well investigated or documented in canine medicine, but definitely worth bearing in mind, particularly I'm thinking in particular about the gastrointestinal potential for gastrointestinal illness, dermatological disorders where the skin is actually telling us that the individual is struggling, and then urological problems as well. So where there's recurrent cystitis, and we know how well documented urinary challenges are, particularly in cats with who are experiencing stress. So these are areas that are definitely worth considering with our cases. And if you're interested in researching this area, then I think it would be fascinating to look for associations here. I'm not saying that one is causing the other, but where there's a strong association, it's just something we need to be mindful of. Where we're seeing clinical signs, we need to be thinking about, is there a potentially a behavioural component to this, and has there been any sort of history of trauma that we need to be mindful of? So triggers, as I'm sure you're all aware, triggers could be absolutely anything, and it could be a smell, it could be a taste, it could be a particular environment or a particular type of person, either visually or in terms of size or illness or age, or basically you name it, it could be a trigger. And where triggers are associated with each other, we can get further and further away from the original trauma, and it can be so much harder. You feel like a detective trying to piece it all together and work out what's actually happened. So again, in terms of TIC, we need to be mindful of the fact that we might never know what the original situation or trauma was. What we do need to document is what we can see now, and how best we're going to manage that to avoid re-traumatization and triggering for the future. So I think that this is actually quite. It seems really, really simple, and I'm sure. Yeah, if any of you've been on safari or anything like that, it's so easy to hear a noise or see something and think, "Oh my goodness, that's a poisonous spider or a snake or something that's terrifying." And actually, it was nothing at all. It was a stick or it was something that was of no risk at all whatsoever. But where you are frightened of something, you're going to see that in situations where it could be something close, or it could be absolutely no risk at all whatsoever. And what's interesting is the way that the brain processes that information and protects the individual. That's the key to it all. The individual's trying to protect themselves from being re-traumatized and avoid situations that they perceive as being dangerous. And I think this one's really interesting as well. So, what they found in children was that depending on the kind of trauma that they've experienced, so you can imagine an individual who has perhaps experienced some sort of sexual assault. They might actually associate somebody speaking to them very kindly and giving lots of compliments and being actually quite coercive in their behavior with something really horrifying and scary happening to them. So where somebody is trying to use soft voices and gentle in terms of their approach to an animal, depending on what their original trauma was, that in itself could actually be really negative and frightening for them. So where it kind of doesn't make sense to us as humans when we're looking at what the animal's doing and the way that we're being around them, and think, well, I'm not doing anything to antagonize them here. Why are they reacting that way? It's just being mindful that actually for that individual, they have an association there that they are terrified of. Um, so even if it seems irrational to you, it makes complete sense to the dog. So just be mindful of that. And particularly where it's tactile or we're using food. So they might have been bribed to do something that was painful or scary or whatever. We just don't know. So it's just being mindful of that in terms of how we manage them. So the clinical benefits of this. So I think for me, on a day-to-day basis, being able to talk to either vets or caregivers about why the animal is doing what they're doing. So either we know there's been trauma or we have a strong suspicion that they've come from a less than ideal beginning, either a puppy farm or they've not had the best care in their first home environment or before that, even while they were with the breeder. So it's just being mindful of the fact that where there's been an early negative experience, it can have a lifelong impact on the individual, and they are going to react in ways that don't necessarily always make sense. So, and that can look like anything at all in terms of the extremes of the behavior. But if we recognize that it's possible and that we're mindful of not re-traumatizing, we can really make a huge difference in helping people to understand why the animals are doing what they're doing and also look at how best to safely manage them for the future. Adverse childhood or puppyhood experiences are obviously, we need to, as far as possible, with both kids and dogs, we need to make sure it's not happening, and that we give people the right advice if they're breeding and if they're acquiring a new puppy, that they make sure that everything is done to ensure that that puppy's early development and early experience is as it should be. The window of tolerance, I'm going to show you that in a little minute. And I think this is something that, and if you Google it, you'll see some amazing versions of it with, the types of windows of tolerance used for kids. They've got lots of rainbows and big smiley faces and all that kind of thing. So I think it's something that you'll find useful when you're either having discussions within your teams or if you're talking to potential fosterers or adopters about the impact of early experience and trauma. I think you'll find it really, really helpful. But trauma-informed care also helps us prioritise and pace our interventions. So we have to be led by the individual and not a case of, right, well, they've been in 7 days, so we have to do this, this, and this, and then we're going to give them a week, and then we're going to do this, this, and this. And that's not what it's about. It's about that individual and how long is it going to take them to reach homeostasis and be able to actually cope with the novel environment and the novel caregivers that they're having to experience now. And then what is going to be an appropriate time to start looking at some sort of assessment and intervention in terms of getting them the right forever home. And I think the key to all of this for me is this idea of changing the lens. So instead of describing an animal as aggressive, we're going to say, do you know what? We either don't know what this animal's experienced, or we know they've been through this, this, and this. And as a result of that, we need to make sure that we're pacing ourselves, that we're showing empathy and kindness and giving them the space that they need, and that we're not re-traumatizing when we're trying to assess them. And that changes everything. It changes the discussions, the labeling that we use, even between individuals in the organisation, but definitely when we're talking to either current or potential caregivers as well. Now, we had a very short discussion about the difference between fostering and shelter environments for rescue animals. And I really like this analogy of the sailing ship going through choppy waters. So where you've got an animal who's been traumatized and they're in the care of somebody who's really calm, really experienced, really knowledgeable in terms of managing, a challenging dog and what works well with them. Hopefully, they can get through those periods of stress and get through those choppy waters as calmly and as stress-free as possible, and get out the other side to safe calm waters. Where you've got individuals who are less experienced, or maybe they don't know the breed, or maybe they're completely novice dog owners, it's going to be that little bit harder for them. They're not going to have pre-existing ideas about what works and what doesn't work, but we just need to be mindful of that and look at who is handling the individual, what experience they are trying to navigate, and then what strategies are in place to help support both the animal and the caregiver as well. So caregiving versus assessment and resilience training. So it's really important that that a traumatized animal has got a safe place to go to, and people that they associate as being safe as well. So if they need a worming tablet or a vaccination, or to get their nails clipped, or something that's potentially aversive for them, it's really important that it's not their safe person that's doing that. They need to know that they can go, that if that person is around, nice things are going to happen and they're safe. And then we also need to think about the risk-benefit analysis for any procedure. So is it vital that they have that procedure today? Is this something that can be staged? Can we do a little bit today and a little bit next week and a little bit the week after? And just be mindful of that in terms of what we're doing and how we're doing it. And then we do as much as possible when they're sedated or under general anaesthetic. So if there's a planned procedure, are there other things that we can be doing at the same time just to avoid anything aversive or triggering happening to them when they're awake and conscious? In terms of the treatment approaches, so CBT is something that I'm sure you're all familiar with in terms of our rehabilitation and our management of animals that have got challenges. If we focus on the trauma and our potential for re-triggering, that I suppose that's the little bit that's novel in terms of the TIC approach. Structured sensory interventions are things like art therapy and music, which absolutely work fantastically well with children. It's not something that I'm fully aware of with dogs and shelters. Maybe we play classical music and that helps to calm them, but it's not something that has been specifically explored in terms of a TIC approach as far as I'm aware. Now, EMDR is a really interesting one. And it's something that has been developed and used in France for a number of years now. And it's interesting because we're basically trying to switch on both the left and right sides of the brain to help the individual reprocess and in a safe, calm environment, allow them to be gradually desensitized to triggering situations. And if you're interested in that, Do Google it. You'll find some really interesting videos on YouTube looking at EMDR in France. And it's fascinating. They're doing it with cats and dogs, and they're reporting really positive results. Now, Share and the SAMSA, in terms of the 4 Rs, are something that we could absolutely be applying like today, tomorrow, with the cases that we're seeing. So realizing just how important trauma can be, and particularly the impact of in utero and early stress in the cases that we're seeing. Recognizing the potential. So where an animal is behaving in a way that doesn't make sense, where we don't have necessarily a history of trauma, it's just being mindful that something could have happened before. So either in utero or with the breed, or even in transit to a new home, something could have happened that is not documented. But the way that the animal is reacting would give you a strong suspicion that there has been trauma there. And we can absolutely be responding with empathy and understanding, as opposed to judgment and fear in some cases. Some of these animals, their reactions are scary, particularly if it's a big individual, or a potentially threatening dog. And we just need to be mindful of the impact of labeling, and how the way we communicate what's happening with the dog, to make sure that they're given the best possible chance for desensitizing to those situations, and finding the right environment where they're not going to be triggered, and where the new caregiver can give them the support that they need. Resisting the urge to retest or test and re-immerse and ultimately re-traumatize the patient is something that it's against everything that we've been doing in terms of assessing and in some way temperament testing the dogs in shelter environments. And it's something that I don't know how controversial it's going to be, but I'm not saying we don't do it at all. I'm just saying that we just need to be mindful of the fact that we could actually be setting dogs up for failing those tests just because of the manner in which we approach it, in terms of how soon they're being tested when they come into the environment, and how we go about doing it. In some cases where for that individual we could be flooding them, and that's something that we're very much moving away from. So we just need to look at the protocols that we're using and the potential for us actually to be doing harm. And for those dogs, it might prevent them from getting a forever home. They may be euthanized depending on pressure for spaces and all the rest of it. We need to be setting these guys up for success, as opposed to challenging them, and ultimately they're going to have a negative outcome as a result of that. Window of tolerance. So I just love this. There was only one term that I've adapted from the Ogden and Fixon original diagram, and that was this idea of coercion. So in our cases in animals, it's very well documented that after a period of stress, we can see what we perceive as the animal giving in, but actually physiologically and behaviorally they have given up. And that is the state of learned helplessness. So everything else that you're seeing in this diagram, we've got the red at the top, which is our hyper-aroused individual. And when I'm trying to explain this to clients, I tend to talk about, I live in Ireland, so it's the Ryanair check-in desk where somebody's turned up late, or maybe their baggage is over the allowance, and you see them starting to get more and more agitated and upset. That's that hyper-arousal. And then maybe they have some shilly-shallying with the poor soul behind the counter, and then they realise that actually they're either going to have to pay a fine, or maybe they're going to have to wait, I don't know, to the next day for their flight. And then they burst into tears and they go into this blue hyper-aroused state. So an individual can move between these. They can start out seeing really passive and quiet. That's how they appear externally, but internally they're numb, they're not thinking clearly, and they're just as stressed as the individual who's hyper-aroused. And that can easily flip. That individual who's passive can be pushed to a point where they then become hyper-aroused and aggressive. And our aggressive individual can start out jumping and barking and looking dramatic, and then give in because they're so stressed. And it's very much situation specific. It could be completely different from one day to the next or one week to the next in exactly the same environment, and it makes absolutely no sense to the caregiver. But for that individual animal, there's something there. There's something they're smelling or hearing, or something. The way that somebody's speaking to them is enough to set this off, and it can easily go in either direction. And I think this particular diagram is something that's really easy for people to understand. Now, these individuals in both cases are stressed, and it can change, in a split second or over time as well. So the practical implications of this. So I've said before, I'd love to see prevention of all of this. I'd love to see us not needing veterinary behaviour referrals, and that we're setting animals up for success with their new caregivers. It's really important we talk to people before they acquire a dog about what they're looking for and where they're going to get it from, and the pros and cons of that, and try as much as possible to protect the mental health of those individuals. I think as vets, we're great at giving advice about vaccinations and worming, and we're not necessarily so good about protecting the mental and social and emotional health of our patients as well. But it is just as important. And to be honest, in terms of figures for euthanasia, we know that dogs under 2 years of age are going to be at really high risk of relinquishment and euthanasia on behavioural grounds. So this is something we have to be getting right, ideally before it's a problem. We need to be really mindful of how we use temperament testing. And it's interesting when you get people, if you get veterinary behaviour people in a room, and you'll get some heated discussion about this, because it's something that charities and organisations have had to do to some degree for a long time, but there's so many pros and cons to it. It's very much situation specific, and therefore not necessarily reliable. So we just need to be mindful about how we're testing, what we're testing, and actually how reproducible is that going to be, and actually are we doing harm to this individual by even testing them? We need to be thinking about the how, the when, and the why are we doing it. And this is a slightly different approach to rehabilitation and veterinary behavioural medicine, but it's something that, in terms of the PTSD and trauma, it's something that seems to be gaining a little bit of momentum, and we do need to know more about it. And I think it's potentially a really useful tool for counselling the owners of dogs, in terms of both prevention and then when we start seeing behavioural pathology as well. And I would love to see less dogs being relinquished and therefore euthanized on behavioural grounds because they're perceived as being either aggressive or so fearful that life is just too challenging for them to manage, either without anti-anxiety medications, or it's just impossible to get them the forever home that they actually need to manage their current behaviour and the things that they're potentially scared of. And I think we need to be placing more value on the mental and emotional health of all dogs in all environments. And this is something that we need to see much more, both training and research in, so that we are using an evidence base for the advice that we're giving people for the care of their dogs. As I live in Ireland, we're probably infamous for this idea of puppy farming, and I think that the trauma-informed care approach very much gives credence to this idea that we have to safeguard the bitch while she's pregnant, and then the puppies in the early days and weeks of their development. And if people want a dog who's going to be safe in a home environment, they have to make sure that those dogs have had the right start in life. And it's so important that we prevent this trauma as opposed to having to firefight once we've already got problems. So it's really important, and I think it's really vital that we accept that trauma is subjective for the individual. it will be unique. So no two individuals experiencing the same trauma are going to have the same after effects. So we just need to be mindful of that. And if an individual is scared, it's real to them, even if we think that there's nothing for them to be fearful of and that nothing bad is going to happen to them. If that individual is frightened, then we need to take action to make sure that they feel safe, and that we're not going to expose them to the things that are potentially scary and re-traumatizing them. This concept can have both clinical and economic benefits, because we can target the way that we're managing cases. We can set the dogs up for success and hopefully get them into the right homes and reduce our number of returns. It's important that we acknowledge that there's going to be some similarities with human medicine and human psychology, but there's also going to be some limitations in terms of what we're trying to do with animals as well. I don't, maybe art therapy is the way to go. I think that would be quite interesting to see is some of the art, some of the shelter dogs might be able to produce, but music, perhaps we've got a little bit more sort of scientific scope or basis for developing that, but utilizing the TIC lens and the window of tolerance is something that we could be doing right now. And in terms of other modes of rehabilitation and management, things like the EMDR, it's something that we could certainly be mindful of and be investigating a little bit more. And it would be great to start looking at how individual charities or organizations can start integrating a TIC approach into what they're already doing, and ideally make it better. So my current research focus is in trying to amalgamate what's already out there in terms of shelter standards. So we've got the guidelines from the States and Shelter Medicine and Community Animal Health, and we've got the Association of Cat and Dog Homes in the UK. So they're fairly comprehensive guidelines about the care of the ACDH's cats and dogs. The US guidance is cats and dogs as well, but at the moment we're focusing on dogs, and if things go well with dogs, we'll hopefully be able to look at it for cats as well, because it absolutely applies to them too. So what I'm trying to do right now is look at where the similarities are in terms of the advice that we currently have, and then how we can apply the TIC lens to the current recommendations. So we're trying to balance human health and safety, infectious disease control, zoonosis, and then also think about behavioural assessments and how we are going to go about recruiting forever homes and giving advice and training to adopters. And TIC's potentially got a huge part to play in that. So what we want to be able to do is, certainly for the behavioural and emotional side of things, come up with a list of recommendations that combine the US and UK current standards and apply a TIC lens to that, so that ideally we're getting some sort of best practice. So we're being mindful of the law and everything that we already have to be mindful of in terms of shelter medicine, but also apply TIC lens to that. So we are safeguarding the mental health of the animals that are in our care. So I think that's going to be exciting and hopefully something that's useful. I'm not saying it's something that every charity is going to be able to start doing tomorrow, but if we're mindful of it and we've got something to work to, hopefully we can elevate standards across the board for everybody. And finally, I can't do a presentation about TIC in our paper without acknowledging Sue. I mentioned her at the beginning. Sue was a very dear friend who is a child psychologist, and she gave me the courage to amalgamate what I now know about trauma in children and apply that to my veterinary patients as well. And sadly, she's no longer with us, but this work would not have happened without her. I would love to have been able to show you a picture of our rescue dogs with our fostered children, but in terms of confidentiality, I can't do that. So this is our latest rescue puppy, who had 2 hours with his previous owner, She met a puppy dealer in a motorway service station, had him for 2 hours with bloody diarrhea, and decided she wanted him put down. Brought him into me at 9 weeks of age to be euthanized. And of course, I didn't do it. And he's been with me for 10 years. So it was a happy ending, thankfully.
That's amazing. Thank you so much, Dr. Corridan. That was fantastic. And thanks to everybody watching today's webcast. Dr. Corridan will be available on Maddie's Pet Forum to continue this discussion and to answer questions. And thank you all. We will see you next time. Appreciate it.